nothing when we say you put for anything, you must put something for life. You must put something for life. The way in good school they say you must place premium on person life. And one thing they say, somebody say if you lost money, you lost something, but if you lost your head, you don't lose everything with that. How do they protect our head for where we say we did? And matter now we will put them out now. Because of this one, go call the person when we say be #1 for health matter for those things, make BC come talk to us. Because they already bring their call, they let us know how we take look after our heads. Especially this one, like say we go the year, say people there for the health sector. Today you will see them here, tomorrow you will see them here. People will sell medicine inside vehicles there, people will send this thing. People, nobody don't get anything when BC they do again, anything when BC they want to do. And they do so take people now. Before you notice that when you put their buy, you will see some kind of fake drugs and the rest of the inside. Before you notice that happen now, here say somebody don't get heart disease, kidney failure, liver failure, and the rest. We go bring somebody come here and go talk to us. So we will look this matter and say concern health matter. Our friend, our brother, the NMA chairman for Edo State, Dr. Valentine Omoifo, welcome to the program.
Thank you very much.
I greet you.
You do well.
This matter, the matter so big that we know can say one person no go fit a little bit matter, and I make them like say me and my brother and friend, the man Akpololo, we'll take this matter together and make we know how to take care of it. So, Ima, I will greet you again. Say welcome to the program.
Good morning, my doctor. I greet you. Good morning.
First, make we start by congratulating you as the new NMA chairman for Edo State. I know it's going to be one thing when we say this thing before they come. So many things then they before they become NMA, before you become doctor, let alone so you become NMA chairman for a state as big as Edo State. If we look at now, what are the challenges when we say you feel say don't they for ground for the health sector for Edo State when you feel say as NMA chairman or so go fit change to improve it?
Well, my brother Sado, thank you very much for that question. You see, challenges plenty well, and we know say for Nigeria concept, you know, they develop. It will not be possible to say we just eradicate all the challenges, you know, particularly within a short period. But we must do our best. We as doctors, you, the media, even the other people from society, to see how we fit, you know, reduce these challenges small to what we call BRS minimum. First and foremost, we don't observe, say, like you talk earlier, this quackery thing, it is very rampant now, and it don't cause many people to go early grave. And I want people will still try to fight how we fit, say, reduce and small. We will discuss with government, give them more policies. If one of our assembly, there are laws we want to send to them to try and pass, you know, and we believe, say, because all this is not policy issues. For instance, if you, some of them don't see travel out to other countries, as small, simple as syringe, you can't buy it without
doctor prescription.
Yes, you're not a medical personnel, you know. So if we get a kind of policy, we will check people's access to some of these things. Apart from things like aspirin, Panadol, you don't fit just enter pharmacy, you know, say you just buy antibiotics, they buy sleeping medicine. So we will encourage government, we will work with them, we'll get policies where we will check these things, at least for our state, you know, that is one. And then even health information coverage too, they're very important. Waiting the people to hear. Like as when I call me comment today, so it's quite encouraging. We need to do more of this kind of enlightenment so that people can hear the truth and know what and what to do, you know, and know where to go for help, know where to go where they get ailments of different kinds, you know, so that they will also get warning signals to know when people be fake, because they need to be alert, you know. So these are some of the things. I'm also looking at health financing, you know. The state government, with the work done now, they're looking into some form of health insurance for people, because people need to get money to access health care. You know, there's a way government can partner with people to pay for health care. So we're looking at these areas, and again, permanent health care, another very important thing. We want to encourage government to take care of those small health centers where people with the rural area will feel they reach quickly. You know, not everybody will run for UBTH or Central. So these are areas we feel we can encourage government to, you know, work along with them in the next 2 years to make some small changes which will help our people.
So now two things you talk. Make I ask you two questions. First of all, how people within know who be fake doctor?
Yes, there are small things.
Two questions.
Then you say, come on, you say now I won't try to liaise with government, and the House of Assembly to ensure say they pass bill. So is it that until they pass that bill, so the people could be?
You know, it goes to what they call short-term measures and long-term measures.
Even medium term.
Medium term, they too. The bill in a long-term measure, we will solve the problem permanently. In the interim, we for NMA, we don't set up an anti-quackery monitoring committee now. We go around, they check the various health facilities. They see, we'll go with police, we'll go with, like the task force. Although it did before, but we don't try to energize them. And the council where they regulate medical practice, they call the Medical and Dental Council of Nigeria, headquartered at Abuja. There's an outfit out there in Benin. We are working with them because they are so ready to check quackery in the system. So we are going to deal with them to strengthen the anti-quackery committee. Even though government hands still there, because that council, they're supposed to send someone to their place of Benin here to take the empower them, like they need to buy fuel, they need to employ police, to go around with them and all that. When I talked with the Bada before, say for some time now, they're not the guest subvention. So we also try to, that's why you see government is very important in these things, because but we want to strengthen, we have our own committee, we need to work with our own committee to ensure that we are moving around properly and we are harvesting information from the public. Like people will see something, like for instance, there's one of the people coming for open access, people will come, carry bus, see that they sell medicine, see that the doctor, they called me from there, and we quickly reached out to the DPO there through phone, and they were to apprehend those people. So this is the kind of synergy we need to require from the public. So these are short-term measures, but the law on where we put final full stop. Those are long-term, medium to long-term measures. So by the time we put all this together in place, it's going that people will be safer.
Okay. So, but I know that your second point will say how they will see who be fake doctor
Beautiful.
And who they operate fake clinic.
Beautiful. You see, it may not be very easy for people to know, but there are some, quick warning signs you could see. Like for instance, no doctor will carry bag the same medicine they go from place to place. Doctors, they sit down for hospital. If we say we want to go do outreach at times, most times it's free. At times we will go to a community, you see all the time.
Medical outreach.
Yes, most times it's free. We don't sell the drug. These are some of the things NMA they do, we not even know. Maybe we don't get enough money to come ITV to the broadcast them. At times people say waiting doctor they do. Occasionally we go to these villages, we buy drugs with our money, we carry our healthcare personnel, we treat the people free, So if you see anybody coming to you in the village, maybe two men, they carry bag, they sell medicine for you, obviously those people are not doctors. Doctors don't sell drugs, that is one. And then not everybody just say wear coat, you could also say be doctor. If you enter any clinic, you can even ask the person, show your identity. Say where they get license that they give medical clinic, you put them on the frame and glass, put them there. These are things you can look out for when you enter any facility.
But you not do many hospitals, many private hospitals.
No, most of those don't even see it there, may not even be registered.
Okay.
Most of them may not be they have expired, they don't bother to renew it.
Okay.
Those are the things we still want to be checking, as a committee that we have set up now. Because even among our colleagues, we want to make sure they are doing the right thing.
Okay.
Before we now start to check the real quacks. So that make it easier for people to know what is
The
real
difference
and what is
between,
not. But anybody that is coming to you to sell drugs, some people carry machines, say this computer will test all your disease. All those are fake people. If there are machines that you can just put in my hand and test all your, but you will see them abroad, you will see them in UPTH, you will see them in Central. So anybody that comes to you with one computer and say, I want to check test, all those are quacks. So these are things that are reality, you can easily see. Anybody that, I'm telling you authoritatively, anybody that comes with a computer, I want to test all your blood, test your body, obviously it's fake.
Okay. Make I come back to you, because I don't know Valentino Moifo for a very long time, not be today. And we they look and say, yes, now person like say if you want something from somewhere, you want to get them, especially to ensure say yes, the life of doctors they improved and the life of people look after the patients they improve. But one thing we say they see right from time and the kind of person when you say you be forceful somebody, our person will take guarantee now say we're not going to see the one we see before. Before nothing happen, doctors say they go strike. They go strike. And this thing now, we now get what I call hypocritical oath when I take. I believe say they call it. When I take say, when I go take help people, even no matter what you do. We don't hear small thing and testing that they won't go on strike because of this or that. I never hear one be saying I won't go on strike because facility when be say they for hospital is no good. Now won't go on strike because I say person drug when be say they give one patient day. Now won't go on strike just because say the way this be say they take care of the patient is no good. But now won't go on strike just because say the money when they give one no reach, they ever they reach. How na go take improve am? Why business that kind of thing will they see when we say come to doctors and strike?
Thank you very much, my brother Sado. That's a very interesting question because it's interesting because it will give us an opportunity to clear the air on so many things that people hear. We know it will be true, like you said, some of us have been involved in union activities over the years, and we believe in say we dogged, we will push for what we really believe in, as much as possible. But our mantra for union at one time has been
they breed the grammar down.
What
you not get from mind for union?
Has been say one, we will consult, and then after that we will consolidate the consultation. We will increase the discussion. We will continue to talk, and then most times confrontation generally in our last resort. But it just be say most times when they don't see trouble, don't they? At that time, now media will carry on well.
Now what we see now,
not even afford to, because all those times we would negotiate.
No carry come outside. No come
the same government we will tell them and say, this will not go on strike. Maybe they will say, not money they big for media, or not to get money like that. So look now, fair. Sometimes they put the carry come cover. But it's what we say. Issues would have been going on. Some of these things we have with government are things of years. Promises that have been made for 2 years, 3 years, or more feed. So the day we come say, we don't tell, we don't feed this again, it will come be like big news. This doctor don't start again. But I can assure you, say, we also encourage you to join us to talk with government. They get opinion leaders too, the press. And one irony way could the matter we say people they get misconception. Most of the time when they go on any strike at all. Now for facilities. Now for the welfare of the patients. Like for instance, the last strike we went to, very unfortunate. We were telling the government, most hospitals that call the state, no doctor, no health workers. Employ people to the work, to take care of people. Now, those are the main issues. If you go to Ubeya, let's say the hospital, general hospital at Uromina, big hospital, bigger than almost bigger than St. Albans, you have only 2 doctors. If you go to the NRG, the same thing.
How many doctors there? How many doctors there?
About 2. So these are the problems we complain for. We are not, you see, our salary, they talk about them, but one, we are not happy when people are not able to access healthcare. We are there to treat the people. At times, we say, look, facility is not there. I was with the commissioner of health yesterday. I still beg and say, talk to our governor so that we know the governor they try, money not today, but health is a priority because if you are not well, you cannot do any other thing. So let us see how we can channel more resources towards health. Talk about facilities, buildings, structures. We had some complaints that time, a ward collapse in Central. So we say this ward don't collapse for many years. They never even feel bigger. Nowhere to admit many patients. These are our complaints, but people don't understand them because the money they involve. No. Because I be specialist in cancer therapy. At times you discover that you even treat patients, they don't want to buy simple medicine, your patient just die in your presence. With the crisis, look, government can provide some of these drugs free. In some countries, they subsidize cancer therapy. Government can do more. Most of the time, our cry, not be for ourselves. But, the way black man is reason, now the way people will quickly hear. But like, I can assure you, we'll continue to, cry out for the public. I tell you, they go with our money, buy medicine, go treat people. It's not because they will pay us back. These are humanitarian services we do occasionally. Even the IDP camp at Ogogwa, the enemy built a house there from his little resources for these people to stay. So we are not as selfish as people think. Most of the time, our cry. Look at ourselves in Benin now. The dialysis center there is not working. I went to see my friend who was the
dialysis center is not working because no worker there.
No, the facility, the machine is not even functional.
Okay.
You go there, you can't even do X-ray, you can't do ultrasound. These are the things we go on strike for. Give us what to work with. So maybe from time to time we will talk to our more so that we understand. Say doctors are not crying for their money alone. Without, if you pay me money, nothing to work with, what will I go and be doing in the hospital? So most times people go to the hospital and say, ah, well, no, doctors are not on ground. They are not on ground because they don't employ them. The few that are there, you will not even see them. You need to wait for a long queue to see the 1 or 2 doctors that are there. But people don't know, say, ah, doctors, they're not there, they're not there. Were they even employed in the first place? So this has been our main grounds with government. But you know, this government has promised that we employ people. All promises are there. Very soon we'll meet with him again because we believe in consultation constantly.
Okay, this matter I don't big well. I just promise we will finish up. Number 1, 2 things we say we won't suggest.
Now, two questions I don't see.
The private hospitals. We don't know if we tell them make that list reduce their costs more so that other people will feel they assess them. You understand? Then 2, you go start with the second one. In case of strike, why don't we think of say, okay, now they won't go cycle just like what they do for a judiciary, where the judges are on vacation, they will get vacation judge. Not so. We don't know if we get strike doctor. For maybe, for instance, doing a strike for UBTH now, there were maybe 50 doctors they work before, now if we leave like 5, just in case, or we call it strike doctor, just in case at the end of the day, people will not going to die like that. Rather than say all the doctors will just stop to work.
Thank you very much, Apollo. You make I start for the second question. You see, like I said, we don't want to go on strike at all. We don't even expect that we should go on strike. You know, we don't believe it's responsible enough for us to go and sit at home. So anytime you see doctors on strike, we will be doctors. If they pay us, say we're not, you know, if they pass for road now, I see the accident, I will stop. Nobody is going to pay me for that. But if they pay us, say we don't go on strike at all. So we hope, we pray, say one day they come for this country, nobody will talk of strike. Things will don't work well. But for now, in most instances, where would they go on this strike? You know, when it be, like I said, our last resort, we already make a lot of arrangements down. Most of the time, 90%, 95%, 99% of the times. Like the last one we went for, the accident and emergency centers were open. ICUs were open. There are always, you know, windows we leave open for people to gain access to.
Only the door and they close.
Yes, it's just that the window may not accommodate everybody, you know. But the very essential ones, we will say, you know, we know if we just let it go like that, you know, we make a lot of, you know, modalities to take care of them. For the private hospital we talk about, you know, those are private businesses, you know, they have to buy everything they use. So you cannot really, you know. I'm coming somewhere. You know, there's an extent to which you can coerce them, you know, or force them to. Even the private practitioners are members, you know, they are an affiliate of the NMA. You know, they have their own association, they are people. But like I said, eventually, now insurance never will win now. The state government is working on it. We are discussing with them. There's going to be a bill for state health insurance scheme. These people will be involved so that you don't need to pay for healthcare at the point you are receiving it. You know, like if people they pay small over time, you can just go to hospital like they be abroad, they'll take care of you, the insurance will cover up. That is what we believe will be the final first stop, and we are working on that, you know, very closely. But I can assure you the way things do for this country now, even the government hospitals are even more expensive than the private. In this Edo state now, I can prove it to you. In many of the, you know, procedures, eventually hospitals stay and everything, people spend more in the government hospital, apart from central, maybe, you know, than a secondary center, you know, and that the government is subsidizing highly to make it free. If you go to UBTH or other major government hospitals, it's even more expensive than receiving care in the private. I can tell you that.
Why be like that?
Because federal government is not subsidizing anything in those areas. People have to pay for everything. So if you talk to private doctors, also talk to government, federal government, state government, please continue to subsidize.
So when you not talk down, because say yes, they look and say the government hospital they very high. Now make even the private hospital they enjoy the kind of patronage they enjoy. So by implication, if the government hospital they bring them down
and services are good there,
people go run more to that place than to the private district. Okay, if you talk like this, now you the amount to do for the hearer, a good like that. Make we look this matter. Now take you go back. So you talk about saying a session of the central hospital say it collapsed. Till now they never do them. Waiting you people as a body they do to ensure say that place they be that now women actually that not the women
I think it was the male medical
ward I collapse also. But what they do to make sure say they rebuild them back. And outside that one now, we get one big hospital where they say they don't already make there, don't already build there. When they say they for front there. You see another day when they put equipment and the rest and that kind of thing. What now they do? Because state government get that place. What they do to ensure say yes, that place it can't be functional. Two questions now ask. Man, I follow my brother Mark Malolo. Two questions
yes,
that they ask.
Two questions that I can't get them now. You do well. You see, we they happy say the media, they also the watch. You know, what did they happen for the health sector? The way we said the same, although we are major players, that hospital, so many issues there, and we know at the time the thing collapsed, the work arm and all that, government set up a committee, a lot of things happening in government, and to the extent that they also have been commissioned, you know, but we never pay the user. We, like I said over time, we did talk with government, we did negotiate, we did discuss, people not didn't know. You know, until maybe while I don't come, people can say, doctors don't go. We have been in consultation with the government as to know what is your plan for this hospital, why is it not in use. You know, we have been discussing, and you know, the project is still ongoing. But I know for the central hospital authoritatively, the governor also said that while he's not in his, I think he has some other plans, you know, to move some part of that hospital to still passenger, you know. I think there are some grand plans that I cannot be discussing here now. So as part of the discussion we're having with the government, there are some plans. We are part of, see, to be fair to the governor, he's involving the NMA.
They bring the grammar condom.
He involve the NMA for
the things when they do well concern.
And that way let you know that why you see things they move well for the states. It they pick up small from where you from pick up, where we from pick up, you know. And these are some of the things we raised even while we went on the last strike. You know, and there were promises that were made, even the building that collapsed and other working environment facilities. So promises have been made. So we see they give government some time, you know, make it actualize those things they say it will do. You know, but we're not just the last, we are still watching closely to see how this is going to come about.
When we come back to the Quack, the committee, when they move around, who they fund the movement? Because my brother, na television we did. For now, nothing like that they work for a day do. No, at the come, nothing like that they work for a do.
These are two questions.
For now, because if get one man when I meet for around the sports complex, you know that airport route, that Kezwa. When you enter Kezwa from airport route by your right, get one place where you do whether na Kupocho.
Okay.
All those people, they are not Nigerians. But that place na Quack.
How you tell us na Quack?
Now the man can't tell me. And the man, he don't go the place. Because the way they treat him is related to somebody.
The man a doctor. I don't make we know. So you know how are they in compliance with what they have?
So many of those kind of places, they don't say they do people of Bubuye. And my brother, we lose so many people all the time. So who they fund them? No, we really now the level that they pay. Then they fund that thing and be gaining way because we dey feel say why this no dey work na because say money no dey to remove out and I no wan talk. That's number one. Two, you dey talk about governor just now. Make I shook you small. Why would I give governor award when you reject?
Well, make I start from the first one before I come to the second question. You see, the committees you talked about, you know, there are the Quack committees. Now, two committees there now. You know, there is one from by the Medical and Dental Council of Nigeria. Like I talked before, they get branch for Edo State here with a director, you know, in place. We the NNA get our own small committee. We with the fund ourselves with our own small money. The committee that's going to be funded by the government.
Federal or state?
It's the federal government agency. They send some money to the state branch to do those work. Now, I don't complain because the madam they don't tell me say for some time they don't get subvention regularly. And you know,
don't they get regularly?
They get regularly. For some time they've never gotten. You know, and it's a big state. You know, if you need to monitor this kind of big state, I think they have only one vehicle they use. you know. We will get our own small vehicle. So if you want to go, you need to maybe hire bus, carry your personnel, you know, give police chop on it, they will follow you. It's, you know, it's a capital intensive project. One, funding is the problem. So that's why I said most of these are policy issues. So we need to also continue to talk with. You see, these are areas we complain to the government about. So
ask you, since we are federal thing, why will not beg governor whether this governor will help?
Yes, these are areas I said we are discussing with the governor. We will be seeing the governor very soon, maybe next week or so. These are the things we are at our minds to talk to him about. And like I said, the continuous thing. It be like say you close one place now, one shop, before you turn back, the man don't open, they don't go. So it's a continuous monitoring thing. The public need to also give information. You know, maybe before I leave, I give some numbers, our own number, the committee number. They need to know. Edo State is big. And that's what the project, like I said, a big project, continuous monitoring of the surroundings. And most times people don't complain. If we not the report say, we see one place, I think are fake there, we will not be able to reach there. So we also need information from the people, you know, collaboration with the people, government, so that everybody will work together. These are areas we can strengthen these committees and make them work better for us. For the governor, even though the complaints say things bad, particularly the health sector, our governor has started well. You know, he had a health summit where health stakeholders were invited, even within and outside, to discuss the framework. Because according to him, we need to establish the health sector in the state from scratch. You know, the former chairman was at that summit. You know, member of the summit group, they draw proposals. You know, this governor has come out with policies on primary healthcare, like I discussed with you before. You know, in fact, I want to be given out to kick off the first 5 of 20. He want to put the primary healthcare in every ward. That is promised. And a pilot project has started. I think the first 20 or so have kicked off. That's what he told us, and we are trying to monitor those people. And he employed a committee health
this grammar they bring and come down.
One of my big,
confuse us.
One of my big organ for primary healthcare chaired that committee to work out the framework on how to bring back the health centers. What they don't break down, what they need to bring new ones, when you don't get facilities, these things that be compiled. You know, so we've seen that this is a government that's showing some interest in health. You know, and they think like us to believe in primary healthcare to start from there. And we see some things when he don't do. The last time we last had the key people, you know, his output was quite encouraging. He was able to help us in the rural again, give the place some dialysis machine, give them borehole. At least his show of enthusiasm, you know, is commendable. And the like I tell you, say we are discussing, although some things never come out openly, say they don't work, everyone they shine, but we they see progress. And in that, with that enthusiasm, you know, we believe that the man is one that needs to be commended. Like
this matter, they do and that's how they confuse me.
All these policy and
because they talk and I myself don't be confused.
I never finished. And again, there are major issues in the health sector that have to do with remuneration also. That affect not only doctors but all health workers. You know, there's a federal improved salary scheme that they pay health
workers, but they're not
be paid. This government has started paying it, even pharmacists, nurses.
Okay.
You know, remuneration are one thing. Maybe they give money, collect money, take job. You can sit down to work well.
To work because they like the sweet time. So why they say the state governor come to say yes, say the what do they call them? What you can happen now when the say yes, say the state government their award one and give them. He refused and rejected.
No, funny enough, that's why many people they get it wrong. The governor did not reject the award. The governor, what he said was that we should hold on for that. He feels he needs to do more. You know that
he never do anything again.
No, that's not what he said. He didn't say anything. He said he doesn't feel he has done enough. That we should wait for him to finish his tenure. You know, that he still had a lot to do in the health sector. And we are happy with that as an association because he has very lifted the bar. You know, he just raised the standard of our expectation for him. We felt the man is doing well, but he said he has still more to do, that we should keep the award until he do all those things we can get for mine. We're very happy with it. It was a cordial thing, you know, because to us, the bar has been lifted further. Like he raised the benchmark for us, so we cannot ask for more things. We cannot put more pressure to meet up with the new benchmark. So I think it's quite, you know, understandable, and we are happy with the development. The award is still there at our office, so we'll keep up for them. So after the end of the tenure, if you feel so it's merited, because with the new benchmark, when you don't give himself, our own pass mark now 50 before we put down.
So like
we don't put down for 90.
Okay.
So when we finish in tenure, if we feel say he meet up that 90, we will still give him. We don't prepare him down.
Okay, you know to the time no be our friend, and this matter when we say you get to do with Quack, I want to when we say the warriors well. A map or say somebody complain to us and say see what will happen. We tell the experience just now. Thomas, I don't feel waka they go now. Somebody will say see what they happen. A man, Ilari Oja feel waka they go they tell them, or maybe Victoria they tell them. But not be every time that we see all these people. But just in case we no fit see any of these people now, we want to reach you and we fit say somebody you do one kind work like what we say we no understand. Like all the thing when we say don't talk now, you carry computer up and down, or you say it's not Quack, say you take your one everything. How we go take reach people then when we say you go call, say oh boy, see what they notice here.
Well, we get some hotlines where people feel reach, you know, both on our enemy side and the MDCN committee side, so we can give out those numbers for people to.
Now make they ask.
No, man, give out the number. If they see anything where they not to understand, you know, they can call us for clarification. Like for instance, the NMA House is director of all doctors in this state. So if you, in all the clinics, we know them. So if you say the clinic somewhere, person is a doctor, we can verify within seconds and know whether you are in the right.
Okay, so just in case somebody like me now, I want to quick meet you now. I want to reach you now to tell and say, where this thing go do? Person when I go meet you, how I beat out meet him. Say the kind of thing. I want to find out from you the person when I go call the number because that number, if you say they very very important. I want me you call the number for us. This one be say you can't wear glasses, so it's just now big business. Now this one be now.
We take it seriously.
Because we just now serious business. That make us say make you. But we know the number.
You can reach us at 080 233 96 928.
I know hear that number well.
080 233 96 928.
Okay.
Another one now 080 27 66 3854.
I know hear that well again. Then now 22 something 080
27 66 3854. So any of these two numbers you reach, somebody will answer you quickly, and I can assure you our response will be prompt.
Okay, you see, we talk and say it should be work, maybe only one man. This thing when we say concern hate, now all of us we need to put hand together to reason of. But don't say you say take advantage of that number, call just in case you see what you be say, you know, they pure for your eye, for health matter. That all of us will work this thing together because we don't feel continue like this. We need to change the things that make other people's life better pass as it be. Don't tell us say don't give some the governor said don't give it a challenge. Say what it be now be say yes say the award I won't give me never reach. By the time I don't do until where my belly go full before now can give me an award. So they wait that 90% or they are about to be say the standard when you reach will go reach there. They tell us the number I use them. And still tell us say that they pressurize the governor on what he will do to make sure say that collapse building for the Edo State Central Hospital so they do and the repair and wear and all that. And see they tell us say they talk to the governor on the one when we say concern the new central hospital they don't build when they will use them. We don't say many things they don't put many equipment for there. Now when they will use them, now it be the question now. And don't tell us say yes, they will make sure say they open the place, make other people the same they use. Dr. Valentine Mindful, thank you so much.
I do well for ITV.
I say congratulations again.
Thank you
I will say yes at the end of the day. You know to say that interview we do with Dr. Mindful. I will regret say we do. We will get the blessing next time we'll call you and we don't see progress before that time.
By God's grace.